Although the pain of this procedure can be managed with pain meds and techniques, it still hurts. So you have to ask yourself, is it really worth it to you? Hey, what's up guys? Victor from Cyborg for Life, and today I want to talk about how much limb lengthening actually hurts. Like how much pain you have to go through in order to fix your leg length discrepancy or get taller. And the reason why I bring this up is threefold and based on patient testimonial. So first of all, during my recent trip to West Palm Beach, Florida, where I visited the Paley Institute for a documentary that we were doing, which was really cool, by the way. You know, I got to meet Dr. Paley and Dr. Robbins, do exclusive interviews with them, tour their state-of-the-art facility and rehab center, and I was allowed in the back of the OR during an actual lengthening surgery of a patient. You know, hearing the painful sounds of the periosteum of the femur bones break. It was pretty crazy stuff, if I must say. Anyways, this patient was in pretty bad pain the day after surgery until about 2 weeks later, where he is now, and although he's managing a little bit better, he still feels the pain. I also met another patient there after his physical therapy session who was undergoing lengthening, who made it clear to me that he was experiencing quite a bit of pain. Now, granted that he was also within the first few weeks after surgery, which is usually the most painful time, but he pleaded with me to make it known to all others that, Victor, this surgery is super painful. It's no walk in the park by any means. And then that got me thinking back to my own tibia lengthening surgery from years ago, and I remember it being pretty darn bad. Now, this was probably due to the fasciotomy that I had of my tibialis anterior on top of my leg bones being broken. But I do remember that all I wanted was my next infusion of hydromorphone, which, if you don't know, is like 5 times stronger than morphine. Anyways, the point is, although the pain of this procedure can be managed with pain meds and techniques, it still hurts. So you have to ask yourself, is it really worth it to you? So what does it feel like right after surgery in between your pain med doses? Well, it's going to depend on the type of procedure you had done, the type of device you had implanted, but according to the patients I spoke to, it was the worst pain they've ever felt. I know that doesn't help you much, especially if you haven't broken anything before. So I guess a good way to kind of consider the pain is, you know, think of like a persistent massive headache or toothache or migraine within your legs times 3 to 5, okay? Or if you're getting tibias done, think about like walking around your living room and hitting the shin bone on the edge of a living room table, and then it throbs and aches all day long and doesn't go down, okay? Unless you take like a pain med, then it kind of like fades off a little bit. But this immediate post-surgical pain usually only lasts for about 14 to 21 days after the surgery, and then it still hurts and aches, but there's usually a pretty big drop off as this initial phase starts to fade away. In fact, here's a little pain chart illustration that can help you see how there's a huge spike early on, but then a steady drop off as you get further and further away from the surgery. This is actually one of the reasons why it can be difficult to sleep in the first few weeks after the surgery, not to mention that sleeping is kind of limited to one position, and that is the supine position. And now that brings me to the point of pain tolerance. What is it and how do you get it? Well, let me start off by saying that pain tolerance doesn't mean that you don't feel pain. It simply means that you know how to mentally diffuse the painful sensations a little bit easier than if you didn't have good pain tolerance. All right, so how do you build up good pain tolerance? Well, according to Dr. Robbins, you should do something physically active that challenges you and causes you a little bit of discomfort so that you can train your brain that these painful sensations aren't going to kill you, so that it can reduce the anxiety caused by it and you can kind of relax a little bit easier.
Post-operative pain control starts during the pre-operative consultation.
Okay.
What the heck does that mean?
Yeah.
I don't give you a prescription. It means I get you psychologically prepared.
Okay.
You're about to undergo a really big thing.
Yeah.
Now, it's minimally invasive, whatever that means. Small little incisions, breaking the bone through a 1/4-inch scar like this. But what we're doing is a dramatic thing. We're hollowing out some of your bone. We're putting a metal rod inside of you, and we're lengthening things. And it's a big deal what we're doing, even though it's small incisions on the outside. And it hurts.
Right.
And it's painful. And you're going to be treated for this.
Yeah.
But understanding that it's a painful process along the way, and really, truly realizing that is a huge thing. And I think some patients don't really understand that. I'm going to take pain medicine and I'm not going to feel pain. And that's not what it's about. Now, if you've had surgery before, or if you've broken a bone before, you have an idea what this is about. But if you've never broken a bone or ever had surgery or never worked out before, you don't know what muscle pain is. And we have a group of patients who come in who they're not very athletic. They've never run, they've never done working out, they've never done things. And so they're really at a disadvantage because they have no concept of what they're getting into. And my job is to help them through that. So rather than just say, show up, have surgery, and I give you some narcotics. It's what can you do to get prepared for this? And one, just understanding that it's a painful process, and we can't make all the pain go away.
Right.
I'm not going to medicate you into a stupor because it's unsafe and unethical and dangerous. But I'm going to medicate you enough that you can function because the pain is going to go away.
Okay.
All the pain eventually goes away, but we have to keep you pain-free enough or without much pain so you can participate in your home therapy and participate in therapy. So the short answer is we use a combination in the hospital of narcotics and anti-inflammatories.
Okay.
You leave the hospital with a short course of narcotics.
Okay.
And my hope is that within a week after surgery, you're off of the narcotics completely.
Wow.
Now, some patients are and some patients aren't, and everybody's different.
Right.
But again, the conversation on the front end of understand I'm not going to make this pain-free.
Yeah.
I can't make it pain-free. The goal isn't to make it pain-free. You may have the expectation that it's pain-free, but I need to change your expectation, because if you don't know what you're getting yourself into, then it's really going to be a challenge for you in. Now, eventually, and that happens, but we get through it.
Yeah.
But if you understand that there's going to be pain and discomfort along the way, that goes
a long way
to helping.
Right.
So then sort of the caveat is, what can I do before my surgery so I have less pain after surgery? I think that's a fair extension of your question. So if you've never worked out, or you've never stretched, or you've never lifted, you've never been athletic, the time to start doing it is before you have limb lengthening. If you think about it, limb lengthening in the rehab process, it's 1 hour a day with us, with professional therapists to stretch you. And then I expect you're going to spend 2 or 3 hours on your own at home doing it.
Yep.
So go start doing something for 4 hours a day that you've never done, and tell me how sore you are 3 days after you start. Well, that's what you're going to do. And on top of that, we're going to do pretty big surgery and bones are going to be broken. So imagine all of these things happening simultaneously. So if you get into the routine of stretching an hour or two a day, or 30 minutes, whatever it is, so your muscles are used to it, but also you're used to incorporating this in your day. So your muscles aren't sore. Start doing some stretching, start riding a bike, whatever. There's 1,000 things you can do. But if you get your body used to moving and stretching, then you won't be as sore when you do that after surgery.
So to summarize, if you're planning to get the surgery done, expect it to hurt a lot. Limb lengthening is not for the faint of heart. You need a bit of grit to get through with it. But if the pain of living with your leg length discrepancy, or the pain of wanting to get taller, is greater than the physical pain that you're going to experience during the lengthening process, then maybe it's worth it after all. All right, guys, that's all I have for you today. I hope you enjoyed the video. If you did, go ahead and hit that like button. Be sure to subscribe. And until next time, this is Victor from Cyborg for Life, signing out. Peace.